Good morning, friends. I'm Dr. Dharmaraj Yadav, Orthopedic Consultant working at Terna Speciality Hospital, Nerul. Today we are going to talk about anterior cruciate ligament of the knee. Anterior cruciate ligament is a very important ligament of the knee, and it is the most commonest injuries to the knee in players, especially football players, basketball players, badminton players who do a lot of cutting and twisting activities. So normally if there is a ACL injury, it presents as a sharp shooting pain to the knee with a popping sound, a sense of instability, and the person is not able to stand, walk and play after that. Once there is a pain and swelling, he visits a doctor examines him and determines that there is an ACL injury. He goes in for an MRI scan which confirms that the ACL ligament is torn. The problem with ACL ligament is it cannot be repaired if it is completely torn. So that's why it has to be reconstructed. Repair means suturing the same ligament back to place. Reconstruction means we have to substitute that ligament with another tissue of the body which is of same strength to perform like a anterior cruciate ligament. So knee has mainly 4 ligaments: anterior cruciate ligament, posterior cruciate ligament, and medial collateral and lateral collateral ligaments. Once the ACL ligament is damaged, people wonder whether it has to be operated always. No. If the person is ready to modify his lifestyle, is ready to give up his sporting activities, then with good physiotherapy and rehabilitation, especially strengthening the quadriceps, hamstring muscles, reducing the body weight, one can manage his life without an ACL ligament as well. But in a young person who has got active lifestyle, wants to play sports, the ACL ligament has to be reconstructed, because without the ACL ligament, you will have a knee which is very unstable, which will make you feel that you are going to buckle every time, you're going to fall every time when you're running and suddenly stopping over, or whenever you're trying to go up and down the staircase fast. So in cases where we have decided that the ACL has to be reconstructed, it is done with a procedure called arthroscopic technique, which is similar to something we call it a keyhole surgery, where through a very small incisions in the knee, the ACL ligament is reconstructed. Post-reconstruction, patient requires almost 6 to 8 weeks of good rehabilitation, physiotherapy, which involves exercises. And overall, for normal walking, it is okay, 6 to 8 weeks, patient can start walking normally. But if the person wants to get back to sports, he has to go for intensive rehabilitation, muscle strengthening exercises, and by around 6 months, he can be back on his field playing the games which he likes and loves so much. Thank you.